Good morning, Prof. Welcome and thank you for being here to participate in this interview. I am Dr. Kazim Arugnade, and I am coordinating the female genital schistosomiasis subject matter expert training for the FAST package. The FGS Accelerated Scale Together package project aims to improve the health of women and young girls by reducing morbidity from female genital schistosomiasis, a neglected sexual and reproductive health disease. The FAST package combines proven interventions shown independently to improve FGS detection and clinical outcomes, prevent further infection through mass drug administration, and raise community awareness. So to create a sustainable system of training healthcare providers within the health system, in Ethiopia, we are conducting FGS SME training at the national level, which will in turn champion the training of frontline healthcare workers, including students in the pre-service training institutions. So based on your experience as an FGS subject matter expert in Ghana, particularly your experience integrating FGS syllabus into the nursing curriculum at the University of Health and Allied Sciences in Ghana, we want to ask you a couple of questions. Your experiences will be shared with participants or trainees interested in learning from them as they seek to address female genital schistosomiasis in their local setting. So to start this interview, please tell us about yourself, where you currently work, and your role.
Thank you very much. My name is Professor Donkor, one of the nursing and midwifery leaders and educationists in Ghana, who has dedicated over a quarter of a century to the noble profession of nursing and midwifery by way of teaching students and also supervising their research work at the university level. Currently, I'm working at the Heritage Christian University College at Amasaman in Accra, Ghana, as the Dean of the School of Nursing. In terms of my education, I completed my Bachelor of Science in Nursing degree with psychology minor at the University of Ghana. And then I had my Master's in Advanced Midwifery from the University of Ulster, Northern Ireland, in the United Kingdom. And in terms of my PhD qualification, I had it at King's College, University of London, in the School of Florence Nightingale School of Nursing and Midwifery. Thank you.
Thank you, Prof. I understand that you previously worked with the University of Health and Allied Sciences in Ghana. In what capacity did you work there?
Yeah, when I was at University of Health and Allied Sciences, I was there as the Dean of the School of Nursing and Midwifery.
Thank you, Prof. So when and how did you hear about the female genital schistosomiasis?
Okay. In 2021, whilst working at the University of Health and Allied Sciences as the Dean of the School of Nursing and Midwifery, I participate in an online workshop on female genital schistosomiasis, part of which was part of FGS Accelerating Scale Together, that is FAST project, and which was led by Bridges to Development in partnership with Geneva Learning Foundation. So after going through that training workshop, which took place between 4th and 11th May 2021, when we completed, we got certificates out of it. And then following that, the director of the Institute of Health Research at the University of Health and Allied Sciences invited me to join a team of FAST package projects on face-to-face training for health professionals in North Tong at Volta region. Further to that, I joined the team for face-to-face SME training in FGS at Weja, and then another area at also in Accra, that is Alisa Hotel. And based on those exposures, I was awarded a certificate for a resource person at the first training of, or the first training for SMEs on FGS in 2022. So this is how I got to know about FGS. And subsequently, you know, I got a certificate for training as the subject matter experts, one of them on female genital schistosomiasis. Thank you.
Prof. Thank you. So why do you care about female genital schistosomiasis?
I deeply care about female genital schistosomiasis because during my training on FGS, I got to know that it could contribute to infertility in women. My PhD thesis was on female infertility with the topic, the impact of perceived stigma and mediating social factors on infertility-related stress and coping strategies among women seeking infertility treatment in Southern Ghana. As at now, I could, some of the words, in fact, that the study focused on qualitative and then quantitative aspect of it. And with the qualitative data that I collected, some of the words of these women still resonate in my ears. So I desired to contribute to preventing infertility in women. That's where my interest developed in, you know, involving myself with FGS. Thank you.
Thank you, Prof. What has been your clinical experience with female genital schistosomiasis?
Okay, I left clinical practice some years back. You know, I was on the ward, you know, practicing nursing and midwifery, especially midwifery. But I left clinical practice some years back. But as an educationist, I support and guide my students to mimic real life situations in the skills lab. For example, as a midwife, I teach my students the midwifery student, how to pass a speculum to view the cervix and the vaginal fornices of women. And with this activity, if somebody is having the schistosoma, the X, which is a sandy patches that we normally see around the cervix, you know, and sometimes you can cite, you know, some of them also in the fornices of the vagina. So with this, you know, I'm able to teach my students to appreciate how this condition can come about and how it can help with the diagnosis of it. Thank you,
Prof. Can you tell me about how you integrated female genital schistosomiasis curriculum into the University of Health and Allied Sciences nursing curriculum in Ghana?
Can you come again?
Can you tell us about how you integrated FGS syllabus into the US nursing curriculum?
Okay. You know, female genital schistosomiasis is a gynecological condition. And when I was at UHAS, or University of Health and Allied Sciences, One of the courses that I was teaching my level 300 and 400 students was gynecology and reproductive tract infections. And the students that I was teaching, some of them were practicing midwives, whilst others were undergoing pre-service training. And you know, when I had training in FGS, my action plan was to create an awareness among my students. So based on that, I decided to treat FGS as a topic in the course that I was teaching. That is the gynecology and reproductive tract infection. So based on that, I put my notes together. And these notes I obtained from the resource materials that I received from the training, and also read the literature, a few literature that I came across on FGS. So based on that, the content of what I taught was I gave a background, a short background on female genital schistosomiasis and how it is acquired by way of looking at the life cycle of the schistosoma hematobium. And then we also discuss symptoms and diagnosis of this condition, and then how it can be treated, the complications that come about, and then prevention. I also had a discussion on female genital schistosomiasis and sexually transmitted infections. As we all know, the symptoms of sexually transmitted infections mimic that of female genital schistosomiasis. So I thought it was important also to let my students also know about the difference. Yeah, so
Thank you, Prof.
Through this lecture, it was my hope that my students will also go out to create awareness of female genital schistosomiasis. Thank you.
Thank you, Prof. As a follow-on to that, how many students have you trained in total? So far, how many students?
In total, I taught about 327 students, all in UHAS. And the first lecture that I had, in fact, I invited staff and faculty who were in attendance, but their numbers were not recorded. I focused only on the students, as far as the numbers were concerned. And for the first lecture, we took pictures and also had a video, and we videoed the program, that section. Yeah.
Thank you, Prof. What challenges did you encounter in the course of integrating FGS syllabus into the nursing curriculum at UAS, and how did you navigate the barriers or challenges?
In fact, I would say that I didn't encounter any challenges, in the sense that, first of all, I was deeply involved in developing the curriculum for my school, that is nursing and midwifery. I was involved in developing the curriculum, and I knew where to place it. And of course, another thing is that where I place it, I was teaching that particular course, that is gynecology and reproductive tract infection. And prior to incorporating FGS into my lectures, I presented it for discussion in a departmental meeting. And faculty and staff were also invited for the first lecture. So the department knew about this program, and they also participated in it during the first lecture, and everybody was aware that this course or this FGS was being treated in one of the courses. Thank you.
Thank you, Prof. What advantages do you see in integrating FGS syllabus into the nursing curriculum?
Thank you very much for that question. Integrating it into our curriculum will enable students and healthcare professionals to be trained. Because as you may be aware, now this particular condition is not treated in our medical textbooks as well as our curriculum. So if we have the opportunity to incorporate it, it will help us to train our healthcare professionals. Again, healthcare professionals will have adequate knowledge and skills to manage FGS. Because as it is now, as I was mentioned earlier, you know, the symptoms of FGS may make that of sexually transmitted infections. So if our healthcare professionals are aware of this, then they will be able to adequately manage, you know, FGS. They will also be able to offer correct advice, treatment, and support to women who are affected. And in terms of the community members in endemic areas will be educated to take the necessary precautions, and then it will eventually be incorporated into our textbooks. So this is how I see it will help us, you know, to enhance whatever we are doing. Thank you.
Thank you, Prof. Do you have any advice for other institutions looking to integrate FGS syllabus into the nursing curriculum?
Please come again. The line was breaking.
Do you have any advice, or what advice do you have for other institutions looking to integrate FGS syllabus into the nursing curriculum?
Okay, I would say that there's the need to adopt a comprehensive standard structure for FGS, you know, and then instructors should be trained, because the way it is, people have to be trained as, you know, it's being done. I also received a training. That's why I'm talking about FGS. So instructors should be trained. And then if I may suggest this, the first project can also consider developing a guide or manual to support institutions in towards the integration of FGS in education. So if the first project can consider that, the advantage is that there will be a standard source of truth that institutions can always fall on. I have included FGS in my current workplace, that is Heritage Christian University College, in my nursing teaching. So I've included it in the gynecology and reproductive tract infections course that will be run here. I will be handling that. And I am a personal ambassador for receiving the training myself. So I will encourage all participants receiving training in FGS to be personal ambassadors. Thank you.
Thank you, Prof. We have now come to the end of this interview. Thank you for taking the time to participate. We have learned so much and we've had a successful discussion. The insights you have shared with us today will be shared with participants, trainees, or people interested in addressing FGS within their system. Thank you once again.
Thank you too.